You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast, and thank you so much for joining me and listening to the show. I'm a dentist with many years of experience, having graduated in 1992, and I've been working holistically since 2001 and have my own dental practice here in Kenmore in Brisbane. It's my mission to empower people to better understand what's going on with their dental health, why it's happening, how to prevent it, what the underlying causes are, and the link that your oral health has with your systemic health and vice versa. So in today's show, I'm going to be talking about some of the blind spots and limitations that we have as dentists because of the way that we're trained, and things that if we were to look into and have a better understanding of would really support our patients in their dental health journey. If you want to know more about dentistry and holistic approaches, then you can hop on over to holisticdentistry.au or just tune in and listen to the podcast, and I share some great information with you. So let's get to it. Let's get in the zone. I want to talk to you about some of the issues that could be affecting your health and your dental health, the 3 blind spots of dentistry that could reduce tooth decay and gum disease. Now, dentists and dentistry can contribute to the health of our patients in so many ways, by treating dental disease, infections, and improving dental function through restoring teeth and correcting issues with poorly aligned bites. But is there more? I believe that through our narrow field of training and focusing only on the structures of the teeth, jaws, mouth and throat, and looking at functionality, where we're constantly fixing problems after they occur, rather than proactively seeking to prevent and reduce the issues, dentists and dentistry as a whole is failing the public in several essential areas. As a holistic dentist, it's my mission and vision to highlight the weaknesses of our profession and the training that we receive in regards to the oral systemic connection. Your mouth and your body impact on each other. I want the dental profession and our educators to improve the delivery of oral and overall health to our patients. I believe it's our duty to support and empower you to understand where the approach of conventional dentistry is lacking, so that you understand better what your needs are, what to ask of your dentist, other health professionals, and how to take charge of your own dental health and well-being. So let's look at these 3 blind spots of dentistry. What are the missing parts of the dental health and wellness puzzle? There are 3 main areas where dentistry is in the dark when it comes to preventing health issues and dental disease. Number 1, dentists don't always understand potential toxicity. Many dental materials, medicines and procedures that are used routinely in the dental office, such as methyl methacrylate, which we make dentures from, amalgam silver fillings, bisphenol A in the white fillings, these have been shown to be potentially toxic to human cells. Of course, toxicity depends on the dose and the frequency of exposure. But if you've got something toxic in your mouth, then its presence could be harmful. Dental amalgam contains mercury, and that mercury leaks out of the filling as a vapor, creating long-term exposure to a heavy metal that's well known to be toxic to the body at any dose. Yet as dentists, we're taught that it's perfectly safe and that the mercury is somehow bound within the filling material. Number 2, the underlying causes of dental diseases. Many studies have shown that just removing dental plaque by brushing and flossing alone does not improve oral health. In fact, you can have lots of plaque and tartar and have no gum disease, as long as your diet adequately supports your health. And on the flip side, you can have what appears to be a clean mouth, yet the gums are still inflamed, unhealthy, and diseased. This is due to poor diet and underlying health and lifestyle factors. Research has shown that diet plays a bigger role in gum disease and tooth decay than mouth bacteria in isolation. These studies showed that when people went from a diet largely compromising of highly processed carbohydrates and inflammatory foods to a diet excluding these foods, signs of gum disease decreased. Hence, your diet is more important, is if not just as important as brushing and flossing when it comes to keeping your gums and teeth healthy. Yet, when I was at dental school, and I know this is still the case, we received no training in diet and nutrition beyond a 1-hour lecture telling us how sugar in foods and drinks causes tooth decay. Nutrition and the right balance of minerals and vitamins plus anti-inflammatory foods are crucial to preventing tooth decay and gum disease. 3, gut health relationship. Our modern lifestyle and diet tends to be detrimental to our health. We are exposed to toxic chemicals and elements in the environment. This leads to toxic substances accumulating in the body. We consume processed, high sugar containing, pro-inflammatory foods, which alters the environment of our gut, and hence the type of bacteria that are present. Toxicity, inflammation, and changes in our gut bacteria are major factors that damage the gut and create overpopulation of unhealthy gut bacteria. This state of being is called gut dysbiosis, which causes damage to the gut, making it leaky. Leaky of waste and metabolites from a damaged gut go into the bloodstream and the lymph fluid and cause systemic chronic inflammation and compromise your immune system. Both systemic inflammation and a compromised immune system can cause havoc in other areas and tissues of the body, including the mouth and gums. In the mouth, chronic inflammation and poor immune response may cause an overgrowth of pathological bacteria and increased susceptibility to gum disease and tooth decay. We become caught in a vicious cycle where ongoing unhealthy food choices continue to feed the pathological bacteria in our gut and mouth. These bad bacteria will cause advances in gum disease called periodontal disease. It will also cause tooth decay if not treated and brought back under control. It is well documented that dental diseases affect other areas of the body, causing nasty back and forth cycle between the mouth and the gut and other tissues of the body. Dental disease is now implicated in Alzheimer's disease, strokes, heart attacks, coronary artery disease, diabetes, erectile dysfunction, preterm births, respiratory tract infections, high blood pressure, and several types of cancers. As dentists, we cannot afford to have these blind spots when it comes to dental disease and the oral systemic link. And we need to educate ourselves and alter the way dentists are trained so as to be able to address these issues and truly help our patients to have better health and healthier smiles. I'm Dr. Rachel Hall. This is the Dental Zone podcast. Thank you for joining me. If you'd like to find out more, then hop on over to holisticdentistry.au. And if you'd like to see me for a consultation, dental checkup, and dental care, including safe amalgam removal, then you can call the office on 0737201811 or email info@holisticdentistry.au, and myself and my team will look forward to taking care of you. Thank you for joining me. This is the Dental Zone podcast, the place where we empower people just like you to understand all their dental health and wellness needs for now and into the future so that you can have a healthy smile for a healthy, long, fulfilling life. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.